Yes, you're welcome, guys. This is your boy Jacob speaking. Now, today I'm going to take this time to talk about the best businesses you can make as a nurse out of your knowledge. Yes, as we know, as nurses, we are not earning a lot of money. Yes, but there are things we can do to supplement on our income. Basically, there are six businesses you can open up as a nurse to supplement on your income. Now, the first and easiest business you can open up as a nurse to supplement on your income is a Class C drug shop. Yes, a Class C drug shop is the simplest you can make. You only need 3 million Ugandan shillings. Yes, 3 million, you can open up a Class C drug shop. Basically, what you need in a Class C drug shop, you need to get a good location. A good location is very important, preferably near a trading center or a place where there is no much competition, somewhere there are many outskirts of Kampala where you can open up a good Class C drug shop. Basically, with a Class C drug shop to open up, once you've got your location, is to have your location inspected. It's a district drug inspectors who usually do this job for Class C drug shop. So you bring him, he inspects your place. There's a small fee for inspection. After filling in the inspection form, another license you can order for is for a suitability of premises. That's very important. So you get a license for suitability of the premises, to make sure that your premises suit and they are good to operate a Class C drug shop. So after getting one for suitability of premises, you order another license from the National Drug Authority, the one which helps you to operate a Class C drug shop as a profession. Basically, you just need to be an enrolled nurse or a midwife to operate a Class C drug shop. It's the simplest business you can operate, and it can supplement on your income depending on the location. You can easily make between 50 to 200 depending on the profession, to supplement on your income. So basically, with a Class C drug shop, one thing you have to make sure is you have to only put their Class C drugs. If you put there things like antibiotics, my friend, they are going to take away all those drugs, and your license will be taken away. So basically, insist on putting their Class C drug shop. I mean Class C drugs. For Class C drugs, basically you need things like over-counter drugs, like lozengas, cough syrups, antimalarials, but things like antibiotics are not needed in a Class C drug shop. So basically, you have to take note of that when operating a Class C drug shop. Another business you can open up is a clinic. But for a clinic, to open up a clinic as a nurse, you need 10 years of experience. Yes, they emphasize on that very much. 10 years of experience to operate a clinic. If you don't have those 10 years of experience, you need to get help from people like clinic officers. Yes, you work with a clinic officer, you use him to get the license. Clinic officers only need 4 years of experience to operate a clinic. Yes, 4 years of experience to operate a clinic. But if you can get a medical officer, even that one is better, because for them they don't need a lot of experience. So those two people can help you operate a clinic if you cannot make 10 years of experience needed by the nursing council to operate a clinic on your own. So if you have all those, and the only amount of money you need is 6 million to operate a clinic. Yes, 6 million, you can operate a very good clinic. And if you are not going to do things like admissions or a maternity center, 6 million is enough money for you to operate a clinic here in Uganda. And a clinic brings in good money if you have your good knowledge and you get your clients, they'll always be coming back to you. For a clinic, basically you need at least 3 rooms. A dispensing area, you can get your examination room, which you can also use as your clerk room if you are limited by space, and you can also get a small lab, where you do tests and then you give good treatment to your patients. So basically, simply, that's what you need to operate a small clinic. So if you need things like maternity centers, if you want to add things like dental, those ones you need more money than that. But for a simple clinic, only 6 million is enough. For midwives, you can open up what we call a domiciliary home. Yes, a domiciliary home. There is no much specifics apart from putting on the antenatal area and a small wing where you can conduct your deliveries. For a domiciliary home, any midwife can do, whether enrolled or registered. You only need 5 years of experience working in a busy hospital, yes, to operate a domiciliary home. So for them, only 5 years you can operate a domiciliary home to supplement on your income. So another business you can do to supplement on your income is you can open up a pharmacy. Yes, but a pharmacy, you need to top up on your income. You need a minimum of at least 12 million. You need a minimum of 12 million. On top of that, you need a pharmacist. Yes, you need a pharmacist to supervise your pharmacy. So if you get a pharmacist, you get good premises where you can put your pharmacy a good location. Then you get a supervisor from the National Drug Authority to inspect your premises to make sure they are suitable for putting up a pharmacy. Then you order for a license. Yes, you need a license to operate a pharmacy. Then with the help of your pharmacist, you get those licenses. And after that, another thing you need to do to operate a pharmacy is you need to register with URA and get the TIN number. Yes, so the procedures to operate a pharmacy, basically a retail pharmacy, is suitable for you as a nurse because you don't need a lot of things. For a retail pharmacy, you need at least 12 million to operate one. Once you put those into place, you can operate a retail pharmacy in a suitable place, and the business continues as usual. Then if you're not so much into setting up things, another thing you can do as a nurse is to become a medical representative. This is a job which mostly newly qualified nurses take up, becoming a medical representative for most of these companies and pharmacies, promoting their drugs and equipment. That's a good job to supplement on your income. They are looking for medical representatives to promote their drugs. So basically, they need people with medical knowledge. Yeah. So these companies look for nurses and other people in the profession who have some little knowledge with drugs and equipments to try to promote their equipments and drugs to enhance on their sales. So this is another business you can do as part of your job, or you can also take it up as a full-time job. There are many people who have benefited from just being a medical representative of a certain pharmacy or company. So it's quite also a very good business you can do. Then lastly, another business you can do, which is picking up mostly here in Kampala, is to open up a home nursing business. Yes, a home nursing business, basically you create a like an agency, or where nurses team up like 6 and they start a home nursing business. The home nursing business, basically it takes care of patients who are from hospital, those ones who cannot be taken care of, like patients post surgery patients, yes, who are at home and they need nursing care. Those are the type of patients who are from ICU and recovering at home. Those are the type of patients who need home nursing. And the relatives or the patient pays the nurses or the agency to take care of their patients. So what they do, they pay your agency, and your organization gives the client a nurse, and it's you to pay the nurse. So basically this is also quite a very good business, and you don't need a lot of money for this one. You just need to team up a group of nurses, you open up a home nursing business, and with all these patients in Kampala who are looking for care, you can also extend your care to other hospitals. Yes, there are hospitals where a patient is there and doesn't have someone and needs that specialized care of a nurse to be there full time. So they come to your agency and you give them a nurse to take the care of them full time in hospital. So basically they pay your agency or organization, and you pay the nurse. So that's quite a very good business, and I've seen very many companies here in Kampala which have opened up such a very good business. So basically those are the 6 businesses you can make as a nurse to supplement on your key income. Thank you very much for listening.